the last product, which is a light mask. It's an LED light. And LED light has been shown to help stimulate fibroblasts in the skin. This is obviously a little bit more expensive compared to some other beauty products on Verishop. And so it's really important when you're looking at kind of like an anti-aging that's a little bit more expensive, you want to make sure that there's good research there, that it's well recommended. When I look for at-home treatments, I look for things that add value to the in-office treatments that we do, that help with maintenance of things that we might do in the office, that we're spending money on sort of research and development studies, proven modalities that we know can help the skin and the appearance and the cosmetic appearance of the skin. We don't want to spend money on just marketing and branding. So I also want to make sure when I recommend an at-home product that it's safe. And so the LED light here is just a red and near infrared light. There's no eye risk to this. There's no risk of burns or swelling or post-inflammatory hyperpigmentation. And it's very pleasant to use. And what this is a mask that goes on your neck and your chest, which is really interesting. There's not that many things like this. Most LED light therapies are for the face, which is great. But to have one for the neck and the décolleté is really interesting because this is an area that's often neglected. It's a very difficult area to treat cosmetically. Aging of the neck, trying to treat aging of the neck and, even chest non-surgically can be difficult, especially the neck. So things that you can do that are kind of anti-aging in this area can be really helpful. So these use what's called low-level light therapy or photobiomodulation. And with a low-level light therapy, it's not like a laser where the laser is causing heat injury to the skin to stimulate collagen. This is not causing injury. It's not causing any heat. It's just red light and near infrared light that's been shown to stimulate the mitochondria of fibroblasts and increase their activity. And fibroblasts are the cells that make collagen. So this is an interesting modality that we can use in the office, after doing a more aggressive laser therapy or, even after in someone who's tan. It really doesn't matter because you're not causing injury. You're just causing light stimulation of fibroblasts. And it's actually been shown to help with burns and post-laser. So if you do a laser and we use red light on top of the laser, it doesn't make it worse. It doesn't burn you more. It actually helps healing. So it's really kind of interesting. The best studied wavelengths are the red light and the near infrared light, which this mask uses. And there was even, many times in skincare, there are very small studies, with just a few people, kind of observational studies. With these masks, there is one randomized controlled trial, which is kind of the best study you can do, that shows that with these two wavelengths of light, using this, periodically, regularly, does increase like smoothness of the skin, hydration of the skin, elasticity of the skin. So I think, if you're gonna spend on anti-aging treatments, spending on a light mask, either for the face or in this case for the body, since that's what we're talking about this week, neck and chest, is not a bad way to spend your money. This lasts, years, and you can use it. I typically will recommend using this a few times a week, and it lasts for 20 minutes. So you just put it on, you click the button, and it lasts for 20 minutes. You can walk around, you can watch TV, and that way you kind of feel like you're doing something productive that is stimulating collagen, helping prevent aging, helping reduce sun damage, but is not, doesn't require your activity like putting something on your skin. So I think this is a really cool product. I've seen it on the neck and décolleté a few times, but rarely. Again, most of these are kind of face masks. So that is that. I think maybe what I'll do is sort of like go over these products again if there are no questions. I can't go back to them in terms of the presenting them to the audience, but you still get a deal. Let's see. So the first one we talked about was oral collagen supplementation, which is a powder that is totally flavorless and colorless, and you can add it to sort of any liquid. And the best collagen supplements, I think, are the Vital Proteins Marine Collagen, and that's what I recommend to patients. Beth asked regarding the light mask, do you use it just once a day? Yes, you would just use it once a day. You could use it as many times as you want. Again, it's very difficult to, if not impossible, to burn yourself with red light because it's just low-level visible light. So you can use it as much as you want, but the benefit is probably with using it sort of regularly, probably 2 to 4 times a week. Anyway, back to the collagen supplements. I think that the jury is still a little bit out, but I think it's probably it's definitely not going to hurt, and it probably does help given multiple kind of small studies that show that there is increased collagen density when people take the collagen supplements versus placebo. So I think I would recommend the marine collagen if you wanted to do something sort of from the inside out to help with your skin. What else can I tell anybody? Does anybody have any other questions? Otherwise, I'll just kind of keep rattling along. The second product that we talked about was this sort of very hydrating repair type Reveal You gel, which is almost like a hyaluronic acid serum. It's a very, very lightweight moisturizer, which I think is really good for the summer. I think it would be great for post sunburns, but any other type of anytime you need moisture in the summer, you want to kind of try to avoid thick, creamy ointment-y moisturizers and kind of steer toward more thin, lightweight serums. And then, there's this botanical called Tepes coite, which is a Mayan plant. I think it's really interesting. These sort of ancient remedies and sort of alternative medicine I've always been interested in learning more about. I think they, often there's something to it when people has used these for centuries for certain conditions. There's probably something to it in the sense that there's probably some antibacterial or other antiseptic properties, anti-inflammatory properties. Unfortunately, we just don't have studies for it. But I think it's, for myself, I'm sort of open-minded about what these things, could potentially do. Beth asks, would I use the serum at night? The serum can be used anytime. You could use it multiple times a day. I mean, it's totally gentle. It absorbs very, very quickly, so you can use it anytime. I think at night, sometimes, sometimes it's better to have, especially on the face, like maybe something a little bit thicker that kind of holds moisture in. This is something that you might put on before that. But it's sort of like a hydrating serum, and then you might want to, sort of occlude it with some other moisturizer on top of it. And then the last thing we talked about again is the light. So, I like this as kind of an anti-ager because I think I did my fellowship in light and lasers, and I think light and lasers are really interesting physically and can be used in really interesting ways depending on how much power you give it and what wavelength you use. And the wavelengths that this mask uses are red light at 633 nanometers and infrared light at 830 nanometers. And these both wavelengths are the best studied wavelengths of LED light. It's kind of crazy that just light on your skin can actually do something biologic, but it can. And that's really cool. And the studies show that what it does is it stimulates an enzyme in mitochondria of your fibroblasts. So mitochondria is kind of like the energy producing organelle in your fibroblasts. And so it increases the energy output of the mitochondria. And so the fibroblasts sort of ramp up their activity. And anytime in the office we're doing treatments like laser to kind of stimulate fibroblasts, that's the whole point. We're creating little zones of injury to cause your fibroblasts to increase their output and make more fresh, thick bundles of collagen and elastic fibers. So anything that we can use to stimulate fibroblasts is great for anti-aging, and that's the whole goal of kind of all of our office treatments. Beth asked how long it takes to see the results of the red light. Again, I would probably give it, I think sometimes people kind of notice a glow right after using it, because it is a little anti-inflammatory. It helps with redness, but so you can see a little bit right after. But then I think with anything, you would probably give it like 3 to 4 weeks before you start noticing anything, and then probably like 3 to 6 months of using it to see sort of like the final results. And then you probably want to keep using it regularly from there. And so, I think especially the collagen supplements and the red light are both ways that, I think can kind of supplement in office procedures. So that's why I like those. They can stimulate collagen, which is what we're trying to do in the office with various laser techniques and injections. And so anything that people will do to stimulate collagen at home is really helpful. Beth asked, what will you notice with the light? So the studies show that it increases. So the things that the things that they monitored were smoothness of skin, hydration of skin, elasticity of skin. So you would, if we did a biopsy, you'd probably see increased collagen fibers and elastic fibers. That's what's kind of behind these clinical results that you're seeing on the skin. So I think with that, we're sort of, I think we've sort of exhausted body. Oh, does it help with skin brightness? It does in some way. Skin brightness can be measured in a few ways. I think skin can get dull when it's hyperpigmented, and it can also get dull when there's kind of like sticky, dry stratum corneum. And I think that the mask is not necessarily going to help with either of those things. I don't think it's going to reduce hyperpigmentation. It's not going to give you hyperpigmentation. But I think there are other things you can do to help with skin brightness, including chemical exfoliators or physical exfoliators. The mask is really more, I would say, kind of like an anti-ager. And I mean, insofar as it's anti-aging, that will help a little bit with how the skin looks in terms of sort of like it's a glow. But it's not necessarily for like skin brightness per se. Okay, well, thank you, everybody. If no one has any other questions, then I will see you all next week. Yes, Beth, it's more preventative. I'll see you next week. And I think next week we'll go over just kind of like skincare 101 again, kind of repeating what we did the first week. All right, thanks, everybody.